Diabetes is extremely prevalent in Australia, with 280 Australians being diagnosed every single day. That's one person every 5 minutes. And men are at a slightly higher risk of developing diabetes compared to women. Diabetes is actually the fastest growing chronic condition in Australia at the moment. Diabetes is a scary thing, but because it's become so common, I think it's kind of lost a bit of its seriousness. We used to take it quite seriously, but now I think we take it a little bit lightly, and it's probably because generally most of us know at least a few people who have been diagnosed. But diabetes is a very serious condition, and we need to make sure that we place a bit more importance on it. So what is diabetes? So when we eat something that has carbohydrates or sugar in it, it's turned into glucose, and this is used in various processes in the body. This is actually our major source of energy. So the pancreas releases insulin, and this helps the cells use the glucose as energy. So in type 1 diabetes, the pancreas is not producing insulin or very little insulin, and they actually have to rely on an insulin injection, generally through self-administration or via a pump. In type 2 diabetes, the body becomes resistant to the insulin, and/or it gradually reduces the capacity to produce enough insulin, and this results in high blood sugar levels. Your doctor might sometimes tell you that you've got a condition called pre-diabetes, and what this means is that your blood sugar levels are high, but they're not high enough to be diagnosed as diabetes. Now, you're thinking to yourself, I know what diabetes is, but how do I know if I have it? Generally, your doctor will pick up on high blood sugar levels in a blood test, but there are some earlier signs and symptoms that you might notice. So some of the earliest signs and symptoms of diabetes include things like excessive hunger or thirst, frequent urination, fatigue, nausea, weight loss or gain, irritability, blurred vision, or tingling in your hands or feet. So there are various risk factors that can actually increase your chances of developing diabetes. So one is genetic. So if you actually have a first degree relative who has diabetes, you're at an increased risk. There are also some ethnicities, so Indigenous and Asians are at increased risk. Your gender, so as I mentioned before, males are at increased risk compared to females. If you have high blood pressure, high cholesterol, smoking, a lack of sleep, and also an unhealthy diet, so that's things with higher sugar and not as many of your vegetables or whole grains, and also a sedentary lifestyle or not being very active. So some of these things we can't change, but there are a lot of these lifestyle factors that can actually be changed, and you can do small things to improve your chances of not developing diabetes. So if you've already been diagnosed with diabetes, it's really important that you keep your blood sugar levels under control. Initially at your diagnosis, it is really good if you can try and make lifestyle changes rather than going on medication. However, sometimes you might need to go on medication as well, depending on how your body's functioning. It doesn't mean that you're not controlling your sugars well if you are on medication, but ideally it's nicer if you don't have to take something in addition. So uncontrolled diabetes can actually have some dire consequences for your health, including heart attack, stroke, you can become blind, you can end up with chronic kidney disease, amputations, and also mental health conditions like depression and anxiety. So diabetes is a serious health condition, but it can be well managed, or it can be prevented by making some simple lifestyle changes. If you know anyone who's been diagnosed or who might be at risk, please tag them below. Or if you have any questions for us, please write in the comments below or send us a direct message and I'll get back to you personally.